Hi, my name is Barbara, and in this video I would like to tell you more about value-based payment systems. If you would like to get to know more about conventional payment methods, I invite you to check my previous video that you can see at the corner of the screen. The idea of value-based payment system is quite simple. It's done via capitation, which means that a country pays a fixed amount of money for each of its citizens. Just in this case, the payment is based on patients' risks. For example, a country, instead of paying 1,000 euro for each of its citizens, pays 100 euros for a healthy 40-year-old adult and 1,900 for a 20-year-old diabetic patient. The doctor then uses these funds as he or she finds it necessary. For example, the doctor can spend 80 euros on preventive tests of a healthy adult and 1,800 for an insulin management program of a diabetic patient, or the doctor can spend 200 euro on a healthy adult for necessary mental health care services and 1,200 euro for a diabetic patient on his self-management program, which in long run trains the patient to better manage his condition and therefore requires less care. The remaining money goes to the doctor's revenue. Value-based payment system has several potential benefits. First of all, primary care doctor would become the central figure in patient's treatment. It is the doctor who would order and pay for the procedures, tests, consultations with other physicians, and operations of a patient. Thus, the doctor would not only professionally and ethically, but also financially be encouraged to follow the treatment course of the patient, because this would allow him or her to predict the future costs of patient's treatment. Moreover, the doctor would be reluctant to get the reputation of a one who only prescribes aspirin, because this would mean that he would start losing patients, because they would be aware that the doctor is not willing to refer to other specialists when needed. In fact, because the payment would be based on patients' risks, not only healthy but also ill patients, despite of how cynical it sounds, would become profitable. In a long run, the doctors would try to acquire as good reputation as possible while containing healthcare costs, as opposed to fee-for-service payment. Doctors should unify themselves into groups, associations, and organizations, and those then would be assigned a minimum number of patients, for example 5,000, because otherwise for a single doctor it becomes too risky, few expensive treatments, and the doctor goes bankrupt. To make the capitation model based on patients' risk effective, pricing models have to be sophisticated enough, because otherwise it becomes quickly apparent which patient groups are more profitable than others. For example, the Netherlands at first were looking only into age and sex, whereas today they also include factors such as socioeconomic status and hospitalization history. As time goes by, models should be more and more refined by including other factors, such as medication history and data from primary care visits. Finally, organizations could choose the risks they want to bear. For example, if they choose the risks of 50%, in case of a profit of 20,000 euro, they would take the profit only of 10,000 euro. But if they experience a loss of, for example, 8,000 euro, they need to cover only 4,000 euro. Whereas an organization that chooses 100% risk has to take all the profits of 20,000 euro, which is good, however, needs to cover all the losses of 8,000 euro in case they experience such. And yes, there would be risk mitigating measures, such as excluding extremely rare diseases and covering their treatment by a separate budget. By such propositions, economists do not intend to say that doctors work for money. Doctors are called for an important mission, saving people's lives. It is the job of health economists and politicians to enable them to fulfill their calling without unnecessary distractions, such as cherry-picking healthy patients in order for a clinic not to go bankrupt. Value-based payment system might be one of the solutions. Thank you for watching this video. I hope it was useful. You can find the references in the description. See you next time.